Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today the topic of our lecture is the HIV Psychiatry or the neuropsychiatric complications after a person contracts this HIV virus. So it can lead to the formation of the syndrome which is known as the acute immune deficiency syndrome, and it has its own neuropsychiatric complications. So we'll be talking about them and covering the psychiatric complications that are prevalent in patients of HIV or in patients who have acquired this immune deficiency syndrome over here. So basically, in the very first section, we'll be talking about the biological aspects of the HIV, human immune deficiency virus, the neuropsychiatric manifestations that are conquered by the person who has contracted this HIV infection, and after that he has developed this acute or the acquired immune deficiency syndrome. So the biological aspects to this infection or after the contraction of this virus will be discussed over here in this very first section. Then we'll be discussing the key points that are to be considered when you have a patient of human immune deficiency virus at your hands. In the very second section, we'll be focusing on the 8 symptoms over here. First and foremostly, we'll be discussing the genetic polymorphs. So how is the genetic predisposition making the person more prone to the development of the immune deficiency syndrome, and then obviously making him more prone to the development of the psychiatric complications as well. We'll be discussing the key points of considerations over here in such a patients, and as well as we'll be discussing CCR5, that is basically the genetic predisposition for such patients. In the very third section, we'll be discussing the CD4 counts. CD4 counts is the highlights of the investigation that is being carried out in the AIDS patients, obviously. What basically happens is CD4 are the T cells or the cells that basically fights off the infection. So the counts that are related to the CD4 type of cells are quite specific and they have their most significance over here in these patients. If these patients have a low CD4 count, that is basically the highlight for a severe disease in such patients. So we'll be discussing the key points of consideration over here in this third section, and then we'll be moving on to the neuropsychiatric complications of such patients, whether they are in the early, middle, or the late stage of the disease, and then the clinical manifestations will be also discussed over here. In the fourth section, we'll be discussing the AIDS pathogenesis over here. We have an early entry of the virus. First of all, what is the underlying pathology? That will be discussed over here. And then finally, we'll be discussing the clinical manifestations of such patients as well. In the fifth section, we'll be discussing depression, which is quite prevalent in patients of acute immune deficiency syndrome. Obviously, it's basically a terminal illness and it's going to affect the daily life routine of such a person. So we'll be discussing that over here. The major considerations will be taken into account over here, and then we'll be moving on to the treatment modalities as well. That will be discussed over here in this fifth and the final section. So I hope you want to learn more about these this HIV psychiatry or the neuropsychiatric complications which are related to the AIDS patients. So do watch the other sections to this lecture as well.